Hello and welcome. My name is Father William Maestri, and this is Overfed and Undernourished. Several decades ago, the great singer Nat King Cole came out with a very popular song, appropriate for this time of the year since we're in the latter days of June, called Lazy, Hazy, Crazy Days of Summer. Well, that certainly applies to us in 2020. However, lazy and hazy really doesn't seem to apply. We're battling the coronavirus. We have civil unrest in our major cities. And to fit the crazy part, we're of course right in the middle of the presidential election heading towards November. So lazy, hazy, crazy days of summer are certainly appropriate for us this year and at this particular time. Among the many issues, and there will be many issues that will come to the forefront in this election year, one that certainly should demand our attention and will is the idea of health care. And health care is often discussed in terms of various plans to supply the best and the most, all the way from universal health care, and on the other end, to allow individuals to develop a kind of medical account, whereby the individual would make their own choices in terms of the services they want, the amount to spend, the doctors, and so on and so forth, and a whole group of other proposals in between those two bookends. Unfortunately, though, usually lost in the discussion about health care is a very important aspect of health care, and increasingly so. And it's very important for those who are really on the front lines: doctors, nurses, technical staff, all of those who really are involved in the entire medical delivery and application system. And the aspect that I'm talking about, of course, is that of conscience and of religious liberty. Here on Overfed and Undernourished, we did a 10-part series on religious freedom. And certainly an important area for this discussion is in the area of medical care, because there are certain procedures which people of faith, people of conscience, and their moral values and their fundamental hardcore beliefs, if you will, really do not allow them to participate in the delivery of these particular so-called services: abortion, contraception, euthanasia, sterilization, various forms of sexual reproductive technologies, sex change operations, and the list goes on and on and on. And there are those who are in the healthcare field, doctors, again, to the lab and all points in between, that really have deep felt convictions, beliefs, that impinge upon their religious freedom and also on their conscience, what they believe God expects of them. And this has been an area of a great deal of tension, certainly in recent years. The Affordable Care Act, if you don't like it, it's commonly referred to as Obamacare. There is a part in there that has caused the greatest amount of tension. And that great attention is called the mandate. That is, those institutions that provide these kinds of services in the OBGYN field, as well as in a number of other technologies having to do with human sexuality and the delivery of those services, that they have raised serious objections on the basis of religious grounds and on the basis of their faith and their conscience. Now, the Affordable Care Act does have a mandate that indicates that if you, in fact, do take federal money, you must provide all range of services: abortion, contraception, and so on and so forth like this. Now, there is a provision in there It's a provision on paper, and here's the rub, so to speak, and we ought to be clear about this. Here's the rub. There is a provision about conscience, or a conscience exception. However, here's the rub. The rub is that it's really not enforced. It hasn't been enforced since Obamacare really came into being during the previous federal administration, President Obama. And the Department of Health and Human Services, who is responsible for the application and oversight of health care delivery in the United States, they really have not either taken seriously these cases of conscientious and conscience objections on the grounds of faith and morals, or they have actually been against the application of allowing people, because of conscience and because of their faith, to opt out of that and not take part in those particular procedures, that they could find somebody else to do it, or some other people could be brought in even from outside to provide these particular services. But the previous administration did not particularly care for that, and while it was in the law, it really was not enforced. It was a kind of paper tiger, or a paper law, if you will. That really changed around 2018 with the current administration, President Trump, in which President Trump took the freedom of conscience as it applies to healthcare workers and placed it within the Civil Rights Division of Health and Human Services, and have vigorously pursued those cases and those complaints and those objections that have been filed by people of conscience and people of faith to participating in certain procedures, medical procedures that are offered in other places. And this movement has been very, very important institutionally, from organization to organization, even if the famous Little Sisters of the Poor objected to certain things having to, that they seemed to be required to take part in, made it all the way to the Supreme Court, and there was a stay that was issued there, but it really hasn't been fully resolved. It really hasn't been fully resolved, and it has been more or less left up to who's ever politically in charge of the administration and Health and Human Services. This is a very dangerous thing to do because it keeps flip-flopping, depending upon who's ever there. We need to remember that religious liberty is the first liberty mentioned in the Bill of Rights, that the government does not have the right, authority, or power to legislate about a person's conscience and religious beliefs. And this is an unfair discrimination because what we're asking people of faith to do is this. You either choose your conscience or you choose your livelihood. Now that is a very, very unjust and unfair option to be laid before people of faith and of conscience, because if people have these heartfelt, sincere beliefs, you're asking them to abandon their profession that they may have spent years in training, large amounts of money to secure that training, their family, other responsibilities that they have, when other options are available. But even if they weren't, the government really does not have a right, does not have a moral right and a constitutional right to be able to hold that as a quote-unquote option. It's very discriminatory. In addition, we hear a great deal of talk today about the need for systemic change. Well, the way in which often medical settings are operated, from schools to clinics to hospitals, there needs to be a vigorous surveillance, if you will, or at least check on what goes on in the actual realities of everyday hospital as well as in medical schools. Students can often feel and are discriminated against if they have objections or raise different points of view. It may affect their grade, their assignment, their recommendation, what medical school they will get into, what specialties will be open to them. And people who have actually graduated from medical schools and nursing schools, and especially pharmacology. Many pharmacists have objections to dispensing certain kind of pills in terms of abortion, contraception, and other kinds of pharmacological entities that they really do not want to have part in. And that has been a severe bone of contention for many of them. I understand that we talk about allowing these exceptions, but in reality, there are ways around that. You know, we have de facto law in fact, and then we have de jure, de jure, which is law in written down, and then you have de facto, which is actually the way in which it's done. And many of them have reported discrimination in job assignments, isolation, loneliness, and also the way in which they are just treated. There's often a kind of silence and withdrawal within the workplace. Very subtle, not overt, but it is certainly there. And that kind of workplace environment, that kind of medical school and nursing school environment, pharmacy school, and various schools and institutions of learning that provide that kind of education should really be free of that. Yes, learn technical. Yes, be competent. Yes, be professional. But at the same time, one does not take off one's white coat or one's nursing uniform when one enters religion, or should one take off one's religious faith when one enters the hospital, the clinic, or the medical school. This is part of who we are, and it is a God-given natural right, the right of conscience and the right to follow one's conscience. And that discrimination really is unjust and unfair. And it seems that more and more people are becoming aware of this, and this really should be an important issue for discussion when we discuss the whole complexity of healthcare, and it is enormously complex, enormously complex. We want to have the best, the most competent, efficient, and expansive healthcare possible in the world. And I believe the United States has the best healthcare delivery system in the world. And but we want to make sure that those who need it, those who lack the basic necessities and resources in order to receive that, are indeed cared for. We are a compassionate, just, and generous society. But we also must respect that sacred area of conscience and religious belief. And so in the upcoming months of discussion about healthcare, and it will be a large part of the campaign, you can be sure, I think it's very important that we not lose sight of the issue of our medical professionals and their right to follow their conscience and their deeply held beliefs. It may be the lazy, hazy, crazy days of summer, but there's also the possibility that in these kinds of discussions, we may actually bring less heat and more light.